Hello and good day. Today I am delighted to interview Professor Mauro Manconi. He is head of the service at the Sleep and Epilepsy Center of the Neurocenter of Southern Switzerland in Lugano. My name is Rana. I am a board member of the ESF Young section. I'm currently writing my doctoral thesis in the field of neurological sleep-wake disorders. Hi and welcome, Professor Manconi. It's a pleasure to meet you. How are you today?
So hi everybody, thank you for interviewing me. I'm fine today, actually. I had a good sleep night and therefore I'm pretty fine.
That sounds good. Professor Manconi, can you tell our community more about your professional background?
So my professional background concern neurologist. Actually, I'm medical doctor. I and then I specialize myself in neurologies, and then actually arrive until here be interested in sleep medicine. To be honest, I always been interested in sleep medicine since the beginning of my career. Actually, that probably was the most important imprinting for my career, for my interests. I remember very well that since my degree in medicine that actually was in Bologna at that time, it was a very, very fascinating atmosphere around the sleep and sleep medicine, because sleep medicine was actually was very young discipline. And in Bologna, I had big mentors like Professor Lugaresi, Professor Cirignotta, Professor Coccagna. So at that time, actually, sleep was almost 90% of neurology in Bologna. And so I had my thesis in sleep medicine already at that time. It was actually concerning hypoventilation during sleep. And then afterward, I moved for residence in another nice city in Italy that was Ferrara. And actually, I became a neurologist, but keep trying to be interested in sleep medicine and especially in sleep-related movement disorders and restless leg syndrome. And then also at that time, actually, my thesis for the residence was about restless legs during pregnancy, and was a very, very fascinating field of research to me. And so then actually I keep going on in the sleep field, because I remember I was actually it was a big challenge to me to choose between two different topics. One was concerning headache and migraine, and the other one was sleep medicine. But that time we had no many chances to be involved in sleep medicine. So then I decided to leave the clinic and go in for 3 years of PhD in sleep medicine. And then actually I moved to US for one year. It was at Wisconsin Medical College, when I tried to challenge myself also in the basic research, animal research. That was something that I missed at that time, because I'm fundamentally a clinical research. And then I moved back in Italy for 10 years working in Milan, where actually I had the chance to work together with Professor Ferini Strambi and Professor Zucconi. It was a very, very nice center. So a whole center dedicated to sleep medicine for me actually was a very important experience. And then actually Professor Bassetti called me in Switzerland, and then I moved to Switzerland, and now I'm leading two sleep centers, both of them in the south of Switzerland, so in the Italian part of Switzerland. So I'm pretty comfortable. And I'm still professor in Bern, actually under Professor Bassetti, and also professor here, because actually we started for 3 years ago. We started with the adventure of having a medical faculty here in Lugano, and that's it actually.
Okay. Yeah, interesting to hear that your fascination for sleep research began so early. Professor Manconi, you organized the annual sleep medicine summer school. Would you mind sharing some of your experiences with us?
For the experience of running a summer school is really demanding, but at the same time really fascinating, and actually is an opportunity to me to challenge myself also in the organization and management of these big events, and actually very educative because I learned a lot how to generate interesting program, how to attract young people to the sleep medicine. So it's a big satisfaction to me to organize the meeting. Now actually we started more than 10 years ago, probably 15 years ago, with the first school that was organized here in Lugano. And this actually, I want to thank to Claudio Bassetti, because actually was his idea to start with a summer school. I had in my background another educational event running every year in Italy, which is Bertinoro, 5 days. So I was already trained in this type of events. And at the beginning, I remember very few students. The name was Alpine Sleep School, actually, because we were just a few countries around the Alps. And then it became a summer school, international school, and now really actually is a very, very much attended and really well recognized event in sleep medicine. And I think it's very useful for young that wanted to enter in the field, actually, or even sleep specialists that would like to be updated. We have an standing high level of speakers usually, and now we are dealing with the challenge to run the school every year. It will be not so easy because we are running every other year, and we are thinking to propose the school every year, just because it's really well accepted by the community.
Apart from organizing the summer school, you have your clinical duties, you are a professor, as you already mentioned. What is your strategy to stay updated, and how did you expand your professional skills and knowledge throughout the years?
That's a difficult question, Chef. So indeed, I would like to be more updated, and it would be very good for me to have time to be updated, to read papers like I did in the past. But I had to change my way to be updated. At the same time, you need to be updated. So when I was young, and this is actually as a kind of suggestion for young people that want like to stay updated on a topic, the best way to be updated, I remember, was by coming from the clinical into the literature and not vice versa. I mean, of course, I had time to read papers, but at that time, the most fascinating way to me was starting from a clinical case and then have time to go deep and then to explore all the differential diagnosis algorithm and then the therapeutic option. And this actually was very interesting, starting from a real case, go deep and try really to help the patient by putting all your efforts, even intellectual efforts, in solving the problem. Now, of course, has become very difficult to do something like this because you have not so much time to see a patient. You have to supervise more medical assistants. And now I changed my way to be updated. And nowadays, maybe the best way to be updated is to try to be in touch, in collaboration with the community, and so be involved with it in a workshop, like writing guidelines, for instance, participating to the Congress, or even actually reading papers. Of course, literature is very important. This is probably the way how to try to be updated nowadays. But also, sleep medicine now is a wild field, and so you have also to select some branches of the discipline in order to be really updated. But probably Congress, a school, writing paper, even more than reading paper, are the best way to me nowadays to be updated in the field. But it's really difficult to manage clinical duties and actually intellectual duties in be updated in the literature.
Mm-hmm. Okay, thank you for your insights. I also wonder, how do you deal with publication pressure?
So this actually nowadays has become really tough be always in a kinds of racing, and the risk is to being crushed in the gear of publications. So and also in the to deal with the impact factor, and to try to maintain the same impact factor of the year before, and try to go high. And the risk is actually to publish a lot of paper, but maybe not so many important paper. So now what I'm trying to do is to try to move step forward in order to select publication, maybe less in terms of quantity and more in terms of quality. This is really the real challenge to me, to generate big papers instead of many papers, actually. And now is the time to go in this direction, to me. Because actually, to write a good paper today, you need a big team, you need collaboration, you need a lot of efforts and putting together different techniques, and this requires time. So the best is to be not really involved in the gear of publication in terms of number, and try to select and put your effort, try to focus your effort in a few fields, and try to write, let's say, more useful papers. This is really the challenge, but it's not easy, because actually you get money, for instance, or you are really, let's say, on the stage until you publish. And so the risk is to, I mean, to publish less, but maybe disappear, maybe more difficult to obtain grants. And so it's a difficult situation. But in any case, my challenge now is to try to select a little bit more and try to generate big papers instead of many small ones.
And what is your idea about the future of sleep research?
Well, the future of sleep research actually is brilliant to me. I mean, actually, sleep medicine is a young discipline, but now well established. We need to be more involved in education, because still now the education of sleep medicine is not enough in terms of medical degree or even residence. And we have to push in the direction of having a specific residence in sleep medicine. I think now is time, because sleep medicine is a wide field. But in terms of research, beside education, I think that the future is really fascinating. So there are some topics of a great interest. Think about what we are understanding concerning the linkage between neurology and sleep in terms of neurodegeneration, for instance. So all the field associated with the protein cleaning through the lymphatic system during sleep, or maybe think about the linkage between psychiatry and sleep. What we are understanding about the meaning of REM sleep, which is really connecting with the emotional balance, or even learning or cognitive process, so much linkage with the non-REM sleep and slow wave sleep. Actually, these are really fascinating fields that might be one of the pillars of the neuroscience in the century. I think, actually, I'm really sure about this, and so I'm very positive about the future research in RLS in sleep. And we have a lot of disease in which we have to go really deep in understanding the pathogenesis and to create a new therapeutic option. So it's a completely open field, fascinating, and I'm pretty much sure that in the next decades we will have many chance to understand the sleep process.
Okay, so are there any specific professional goals and projects that you have for the future?
Actually, my goals in the future in terms of managing is to try to set up a sleep lab really dedicated to the wild field of sleep medicine, try to give an opportunity to the population to be treated for all sleep disorders in a really sleep medicine disorders. I mean, putting together the expertise of many different specialties, and actually involving the physicians, expert in sleep medicine, but coming from different experience, like pediatrician, psychiatrists, neurologists, and pulmonologists. And this is actually something that I'm doing. I'm really happy, satisfied about this. Concerning research, I mean, the big ambitions, this is just like a dream, is to try to understand better the mechanism behind the specific disorders, which actually is really fascinating to me, and is the main topic of my interest, which is restless leg syndrome. So it's a complex disorders, and even actually I would really in the future give my contribution to understanding the pathogenesis of this disease, which is actually still very unclear. And this is actually a dream of my lab, and my efforts are mainly dedicated to this topic today.
So we as a community are interested to see what is next to come. So you work a lot, right? What role does a work-life balance play in your career, and how have you maintained it?
Managing working and family duties is not really easy. Well, my choice was to actually to try to choose a place and try to stay in the place. Actually, yeah, there is the risk to move around in the world and bring with you the family, and sometimes it might be not really easy for the families to adapt every time in a different country. Maybe on one side an adventure, but on the other side might be difficult. So my decision was in the last 10 years to settle here in Switzerland. I'm pretty much fine here, and I bought a house very close to the hospital. And I mean, when I can, I stay with my children, my wife. This is what I try to do. It's very difficult. Sometimes they suffer about my absence. This is natural, but actually, my hope is that sometimes to have a father, I mean, to have an example of a father so passionate in a research or in a topic might be even a good example for them. Probably not like having me every time, but at the same time, might be a kind of, let's say, a mentor that you have in the family in order to manage your life. This is my hope. But of course, I always have a dinner with them. This is something that is mandatory for my life. And so I decided to have always a dinner with them, but the rest of the days I'm pretty much on work. And my holiday, I dedicate all myself in the family. Actually, this is how I try to manage this.
Okay. You mentioned your role as a mentor. What advice would you offer to young professionals looking to establish themselves in the area of sleep medicine?
Hmm. My suggestion for the youngs, if you wanted to establish in a specific field, of course, it's a banal suggestion, but it's true. To study, to try to go to the literature, try to be interested. Actually, the curiosity is really the main positive features that I would like to see in my medical assistant. When I see that they have a curiosity to understand, this is already enough to me. So the rest will be easy. Instead, when I see assistants that are not really interested, they want just to arrive at the end of the visit and actually to become simple a doctor without research. I mean, research is important also for physicians that would like to address their career only on the clinical side. But the research is like a mentality, not really a work. So my suggestion is to foster curiosity and try to satisfy your curiosity. And this is actually make your work interesting every day. And this is actually what I try to do still now, if it is difficult. And this is what I require from my young medical assistants.
Thank you for your valuable advice. I have a final question for you. How do you sleep? And do you have a sleep routine?
Oh, I mean, sleep occupies 1/3 of your life. It is impossible to sleep well every day. I mean, when I see patients sitting in front of me telling me I don't sleep well, is more or less like that I see a patient in front of me telling that I'm not living well in the daytime, actually, because this is actually the other 2/3 of your life. So it's impossible to sleep well every day. Sleep, of course, reflects your your daily life, your problems, actually, your disease, and it is a fluctuating process. And so I do not expect to sleep well every day. Now, what I learn is that my sleep, for instance, personally, is really deeply correlated with emotion during the day and the stress of work. And on the other side, is really also correlated with what I eat during dinner. Actually, these are two weak points of my life. And then now I understand to manage this. So I use sleep and insomnia in order to understand if I'm going the wrong direction in terms of maybe eating or stress. So every time that I have some nights of insomnia, and this is actually something that happened to me, instead of suppressing with by using the medication, it's a kind of me is a kind of alert to me. So the brain is telling to me that something is wrong, maybe the stress is too much, and so I use insomnia in order to modify, which is actually the core of cognitive behavioral treatment on some in some way. So I don't sleep well every day. I sleep well depending on what I do during the day. And every time that I have a day of insomnia, I try to manage it like cooling down all my daytime stress. And usually it works, actually. It usually works.
Thank you, Professor Manconi. It has been a pleasure. Thanks for your valuable insights, and I wish you a good day.
Thank you to you. Have a good day.